You want to start off by just sharing, we could each share a little bit about ourselves and then we can jump into some of our questions and topics.
Yeah, yeah, that sounds great. So I'm Karla. I'm an occupational therapist and I specialize in pelvic floor therapy. And I help women who experience leaking pelvic pain, if they're laughing and at work, helping them to get back to their daily lives and not letting their pelvic health issues affect them. And, we think of physically when we're laughing, maybe that abdominal pressure causes women to have leakage or something, but it's more than that. It's, if women aren't laughing as much, if they're not having this joy in their life due to their pelvic health issues, that's something that we can address holistically and, get to the root cause of how is this really how are these pelvic health issues holding you back? So
Yeah, that's awesome. I'm Emily and I'm a psychologist and I work primarily with parents that are navigating infertility, pregnancy loss, pregnancy and postpartum. And I've definitely seen in my work as a psychologist. Yeah, so I see in my practice a lot that there's a strong connection between mental health and pelvic floor issues. Um, and it's something that is, as a psychologist, as a therapist, I kind of struggle to help clients navigate. And I've been trying to learn more about the connection between pelvic floor health and mental health and how we can support people that are experiencing those issues. And I know it's like a pretty large spectrum or there's a lot of different kind of issues that could come up or preventative stuff that you can do. But I was curious, Karla, like, could you explain just like what is the pelvic floor so we can better
yeah,
understand what that word even means?
I know. What is the pelvic floor? Like nobody really hears about it until they have issues with it, right? So the pelvic floor is at the base of our spine. It's within our pelvis. It's a group of muscles, tissue, ligaments, tendons, nerves, and it's this hammock shape underneath within your pelvis. And it has three main functions that I like to talk about with my patients. And the first one is elimination and holding urine in and bowel in too. It's being able to be continent or be able to do things without leaking, right? Or even having constipation, right? That's a big issue, especially with women during pregnancy or postpartum. Like, work with a lot of women that are having issues with constipation. So the elimination and holding urine and bowel in is really a big thing that we work on. The other is intimacy. When we have an orgasm, it is that fluid movement, contraction, relaxation of our pelvic floor muscles. And when those muscles are kind of tight or you're not being fully able to be present, and that can, affect your relationship and that intimacy portion of within our pelvic space. And so another one of the third things that we talk about is support. So those pelvic floor muscles are literally at the base of your spine, holding up your 10-pound head and, the rest of your body. So those muscles need to be able to not only contract to hold things in, but just have a fluid mobility and that coordination piece to, as you take that first step when you're walking, that energy travels up to your pelvis. And if there are some muscle imbalances, that's going to potentially cause some pain or issues as well. So that's the pelvic floor kind of in a nutshell. And there's another piece that it's not, directly what the pelvic floor does, but there is this autonomic component to it that we see a lot of women who, are having some issues as far as the mental health piece or the stress piece. And, that with our body is always fighting something or going into these different trauma responses, those pelvic floor muscles can respond to that as well. So kind of really getting to the root cause of what is your body experiencing and why is it? So really doing a deep dive holistically is important.
So what you're saying is that the mind and the body, including the pelvic floor, are connected. So if you're going through something or you're experiencing a stress response, you're going into fight or flight, your pelvic floor can be impacted by that. And it might like tighten? Is that a common response to tightening? Are there other things that your pelvic floor might do that could cause issues?
So yeah, definitely. It could be tightening. It could be from a bowel perspective. You know, if we talk about fight or flight, we're kind of going into that hyperarousal state, right? But then if we're talking, if we want to get into this nervous system component on the other end, where there is this of our nervous system, if we're going into like immobilization in this depressive state, you know, things are not moving as well. So we see a lot of women or people with constipation issues that potentially may also have depression. So it's all connected, and this is something that, you know, it doesn't get talked about enough, and that's why I love this collaboration and talking about this, because I do feel like OT and just my practice can just be a really good merge into getting that, you know, the serious mental health practice like with you, or a psychologist that they need, and then following that, like that deep dive into the mental health space, getting back into the routines and you know, activities that people love to do after they've done that deep dive, that deep work that might really be needed.
Yeah, I know one thing that I really like about your approach is that you're not just teaching your clients strategies or exercises that they could do physically by engaging their pelvic floor, but you're also teaching them about their nervous system and helping them learn ways um, to promote the relaxation response, right?
Yeah, because
Um,
I mean, some people might really, they really want that exercise piece, and that we know from research, like exercising is so good for people's mental health, you know. But then there's moms, or there's other people that doesn't resonate with them, or they're just too overwhelmed to have a specific exercise routine. So it's like, okay, let's break down what you're doing during your day, your everyday occupations, right? What
mhm.
are those? And really doing what we call like an activity analysis, and breaking that down, like what is your pelvic floor doing while you're reaching into the fridge, and or getting on and off the toilet, or, you know, bending to change the baby on the baby table. Like, how can we incorporate that into your functional program versus maybe a specific exercise program that maybe not be something that resonates with you at this time.
Are there any specific relaxation strategies or exercises that you do with your clients to help promote that relaxation response if they are experiencing pelvic floor issues?
Yeah, so there's different strategies, and it's all about kind of tapping into, we're going to get a little nerdy, and getting into this parasympathetic nervous system. So this is that rest, digestive part of our nervous system that for many women, if we're very active, doing things, we're just always on the go, where it's like we need to promote this sense of relaxation. And for some people, you know, that is very hard. Like if you have anxiety, if there's other like ADHD, like it's hard to be present within our body. So finding that safety of, okay, I can try to calm myself with these strategies. So obviously breathing is really good. Like we do a breathing, or I do a breathing assessment with all my clients, because our breath is, we have that with us every time. That is a great strategy. And so for a lot of women, if we're doing a breathing assessment, you know, we're seeing if that pelvic floor is coordinating with the breath. Or a lot of women, if they haven't gone through this before, they're potentially kind of breathing opposite, where ideally when we take a breath in, we're wanting that rib cage to expand, that diaphragm goes down. And so for some, if they are breathing in, they could potentially be contracting
Mhm.
instead of lengthening and letting everything relax down, especially that diaphragm. So you know, so the breath work is really really big. Other nervous system regulation strategies, you know, a lot of vocalization, being able, like humming. We teach this a lot, like during um, you know, prenatal prep and birth prep, is, you know, transferring that energy through
Because
vocalization.
that stimulates the vagus nerve.
Yeah, that
Um,
stimulates the vagus nerve, and that vagus nerve is so important to being able to find that safety within our bodies. And so during pregnancy, that's something, you know, actually really resonated with your call with Nancy on the postpartum psychosis, and she shared how during her birth, you know, it was just not such an unsafe environment. And you know, those are just things that we really want to try to focus on is that safety within our body, and that is through connecting to our vagus nerve. And so other strategies are, something that doesn't get talked about enough is support. That can really be such a great strategy is, for women who do have this pelvic pain, like if you have a spouse, like that face-to-face conversation, that co-regulation, that eye contact, that is so good for our nervous system and finding safety for that. So those are a few tips, but it depends on a person's nervous system. Like if they are extremely upregulated a lot, yes, we need to kind of work on more of those grounding techniques, those grounding strategies. But if they are more kind of in the depressive state, they need to be more mobilized. We need to get them out of, that low energy, low nervous system spot that they're in. So it's definitely individualized, and there's no one size fits all for that.
Those are great tips. One thing that I've been trying to work on too is I've been meditating for a long time, like probably about 10 years, and I do it every day. But I'm really bad about I'll meditate and then I'll go out into my everyday life and then I notice like I'm holding in my breath and I'm kind of like undoing everything that I just tried to do. Where when I'm meditating, I'm very intentional about how I'm breathing. Trying to be very aware of where my mind's going and redirect it back to my breath. But I almost tell myself like when I'm not meditating, like it's almost like a free for all. So I try to check in with myself about how I am breathing and notice like if I am making my breaths more shallow or I'm contracting my stomach. I know a lot of women do that. We're told to suck in our stomach. So a lot of
But
us naturally
yes,
breathe like that. So I just try to have these like mini check-ins throughout the day of like, how are you breathing? And then just take a couple deep breaths right now. And more often than not, 98% of the time, I'm not breathing
right? Yeah,
fully. So
yeah.
those check-ins are really helpful.
Body awareness piece is so important, and if we're not aware of that, we don't know to improve it. So those check-ins are great for sure.
Yeah. So we talked about how the importance of breath work, other grounding techniques, relaxation strategies, the vagus nerve, all these things that you can do. You can do them with a provider like an OT, a PT, a psychologist, a therapist, or these are things that you can also do on your own. And there are so many resources out there to um, help you regulate your nervous system and induce that relaxation response. Um, yeah, when should someone seek help for pelvic floor issues?
Yeah, great question. And that's something that I'm really passionate about, is just being very proactive in our health, because someone should seek out if they're seeing some changes. The earlier you start working on and improving things within our body, long down the road, it's going to be that much more beneficial, because not only from a physical perspective, but just emotionally and mentally, if you're experiencing, some pelvic pressure or pelvic pain, and, every day for months and months, every day you're waking up, oh, I still feel that. Oh, I still feel that. What is that doing to just your energy levels, and able to kind of find a provider that knows what you're going through, that can help you out, that you can trust to improve, is so important. So I'm a big advocate on being proactive. I created a short course. It's called Breathing to Connect to Your Pelvic Floor. And it's just like the basics of pelvic health and understanding some of what's going on within the pelvic space. Because if you can understand all these and then go to a pelvic floor therapist, like, you're going to be saving so much time on and being able to get to the root cause of what's going on.
Yeah, so if you're feeling any kind of discomfort, and like you said, sometimes providers might, you might feel dismissed by them, or they might tell you, like, this is, you just had a baby, this is normal. You know your body, if something's not normal, and it's never too early, it's never too late to seek out that help. I know we did get one comment. Also, just noting that massage therapy, that's great for nervous system regulation as well. So that could be another wonderful resource or provider that you could seek out if you're struggling.
Mm-hmm.
Yeah. I'm curious, Carla, do you have any questions for me or anything that your audience shared that they were wondering about the mental health and pelvic floor piece?
Yeah, for sure. So, I mean, from your standpoint too, like when should women seek out professional help for their mental health? Like, what would you recommend?
Yeah, I pretty similar to you. I feel like it's never too early, it's never too late. If you're feeling like something's not quite right, or even if you're anticipating that you might have a hard time with something, you should absolutely seek out mental health support, seek out a therapist or a support group. I have a lot of families that are coming to us when they're actually pregnant and they're finding that their pregnancies are going pretty smoothly, but they're aware that they're at higher risk of possibly postpartum depression or anxiety. So I think that's always a great time to get in there, being proactive rather than reactive. But if you are struggling, it's definitely never too late. Like you can still jump in, even if you are having a hard time, and that's also a great time to get that support.
What are some of those risk factors for postpartum depression?
Yeah, there's a lot of them. So some of the most common ones are if you have a personal history of anxiety or depression yourself, or if you've had postpartum anxiety or depression in the past, you are at an elevated risk. Support is also a big one. So if you have a stressful relationship with your partner, or you feel like you don't have really a good support system in place, that can also put you at additional risk. And having complications during pregnancy, having a difficult birth experience, a birth trauma, those are all risk factors. Having multiples, so twins, triplets versus singletons, having being a teenager who's going through becoming a parent, that's some of the higher stress parenting. Um, yeah, those are some of the most common risk factors.
Hmm. Yeah, I hear a lot from different moms that I work with that they have that mom guilt. And, do you have any experience with that with your clients and feeling like they're not good enough? Like, is there any way to kind of prevent that mom guilt, or what would you recommend?
Yeah, I kind of feel like mom guilt is a little bit par for the course. Like it's like part of the experience. But that doesn't mean that you have to suffer with it or that there's nothing that you can do about it. But I've yet to meet a mom who doesn't have any little bit of that mom guilt. But I think when it comes to an emotion like guilt, there's the function of guilt is if you've done something wrong or you're not doing something well, you feel guilty because it's supposed to make you do things better. Or it's supposed to make you reevaluate how you're doing. The problem with mom guilt is sometimes we feel that guilt even when we haven't done anything wrong or we really are doing our best. So I encourage people to check in with themselves and ask themselves those questions like, am I really am I really messing up here, or is this emotion kind of giving, is this like a false alarm going off? I really am trying my best, and there's just really hard, and it's a hard set of circumstances. So to try to kind of like challenge that guilt a little bit and not necessarily take it at face value or assume that it's telling you the
Yeah.
truth.
Oh my gosh, I love that answer. That's great advice for sure.
Yeah.
So another thing that comes along with, pregnancy, postpartum is that sleep deprivation and exhaustion. How can women support their mental health while dealing with this?
Yeah, I'm glad you brought that up because sleep deprivation is actually another risk factor for a perinatal mental health condition. And I think, we all know like sleep deprivation is part of having a newborn. And sometimes there's almost this um, perspective that it's like a rite of passage to not sleep for the first couple months when you have a baby. But rest is super important. So I really encourage people to try to work with their support systems on figuring out ways to get better sleep or better rest and to just kind of get creative with it too, whether that's being able to rest throughout the day, um, being able to have some help with night feedings, things like that. It's much easier said than done. And obviously, everyone's situation is different. Not everyone has that support accessible. But if you can kind of brainstorm with your support system on things where each person can get at least, a couple hour straight block of sleep um, at night, and that really is ideal. And another thing that comes up a lot is that even if people sometimes have the opportunity to sleep, especially new moms, they might be having so much anxiety or feel like their thoughts are racing that even if they have the opportunity, they can't fall asleep. So that's really where those relaxation strategies that we were talking about before with deep breathing, with mindfulness, the grounding, those are really good ways because your mind and your body are going into that stress response, that fight or flight. So if you can do those things to help calm down your nervous system, you're more likely going to be in that state where you're going to be more likely to fall asleep and relax.
Yeah, and the sleep is just so important. Also, from a tissue perspective of and healing, like letting our bodies heal during sleep is so important too. So if we're not getting that sleep, from a musculoskeletal perspective, like that's also something to consider. But from a nervous system perspective, like you kind of mentioned, with the resting, there's a lot of technology that's out there now. To assess your heart rate variability, the HRV, and that's something that, with different devices that can track that for you. So if there is a heart rate variability that's kind of lower, trending lower, that's something to really check in and say, wow, I really do need more support right now. I really need to focus on my sleep and rest. So that's one strategy to also look into.
Yeah, I often find myself trying to encourage rest, I guess more so than sleep, because I find sometimes the word sleep can even be a little bit triggering when you're like, I can't, there's no time, the baby doesn't sleep, or at least sleep when I want
Right.
him or her to sleep. So I try to encourage people too to focus on rest so it feels like you're putting less pressure on the sleep. And to create that sleep environment that have good sleep hygiene, like having a dark room, possibly some white noise, appropriate temperature. I think they say it's around like 68-ish degrees is the optimal temperature for most people to sleep. So like doing all those things, avoiding caffeine, to just create a good sleep environment, you're going to be more likely to be able to, hopefully fall into that. You don't want sleep to become stressful or something that you feel like you're trying to force, and
Yep.
sometimes I see that happen with new parents, especially new parents that are experiencing anxiety. So I really try to get them to take the pressure off and don't look at a clock and cover up the clock if it's in your room. Don't look at it because when you see the numbers ticking by and you're not falling asleep, it's going to exacerbate your anxiety.
Yeah, those are great tips. So to kind of dive in a little bit, maybe more for your specialty, and so how can women cope with anxiety or intrusive thoughts about their baby's safety? Because that can be something that is really affects some women.
Yeah, intrusive thoughts are actually really common. I think the research says that about 90% of new moms experience them. And intrusive thoughts are thoughts that are really distressing and often disturbing to a person and things that often are unwanted. So, for example, a common one that people report is this fear that they might drop the baby. And they by no means want to do that, but it's kind of this thought that jumps into their head that they feel like they have no control over. And then once it's there, they feel like they can't get rid of it. So when it comes to intrusive thoughts, I I really encourage people again to do a lot of the relaxation stuff. So the more you try to fight the thought, often the stronger it becomes. It like kind of gains power. So if you can remind yourself that it's just a thought and that the thoughts don't mean anything, that can be really helpful. And I really love this exercise called Leaves on a Stream, where you kind of like picture yourself sitting on the bank of a stream and you picture the thought placing it on a leaf and then you send the leaf down the stream and then another thought will come back and again you do the same thing, you place the thought on a leaf and send it down the stream, and you might have to do that 100 times. That's okay, as long as you're catching the thought and then you're practicing releasing it, you're getting better at being able to have control over those thoughts versus allow those thoughts to have control over you.
I love that. That's a great visual imagery and just like repatterning our nervous system. Like that's awesome.
Yeah. So do you have any, I know we're almost at 2:30. Do you have any last minute thoughts on this topic that you wanted to
I
share?
don't think so. I mean, it's been a great talking with you and just being more proactive for women to give them support. And, it's never too late to get started.
Yeah, I think those were the key takeaways that, um, w- if possible, being proactive rather than reactive, but it's never too early, never too late to get support. And really, that connection between the mind and the body, the nervous system, and your pelvic floor, and all these different strategies that you can use to help calm your nervous system will help, with things like your pelvic floor.
Yeah,
Um,
for sure.
yeah, thank you so much.
All right.
Right.
See ya.
Bye.